Thanks, Tabs.
All right, to add a healthy dose of skepticism, we are bringing in former Associate FDA Commissioner Peter Pitts to answer all of your questions about vaccines. Peter, thank you so much for taking the time to join us. We're actually going to start with the Pfizer vaccine. The FDA authorized the shot to be used in 12 to 15-year-olds after clinical trial data showed it was 100% effective in preventing illness. What exactly does that mean?
That means that when 12 to 17-year-olds were tested, none of them came down with the virus who received the vaccine, and that's really quite incredible. It's even better than the 95% effective rate for adults. So kids are not only going to get vaccinated right now, they're going to actually get more immunity, if that's even possible. It's really quite fantastic, than adults. So good news. And as we move forward toward summer camp and summer activities and barbecues and sports, it'll be good for kids to be able to get out there and socializing. They missed a whole year of that, so it'll be good to get back in the game, so to speak. But most importantly, it has significant ramifications relative to what happens when school starts. We want to start getting kids vaccinated as soon as possible. So when school starts, we have as many of them as possible vaccinated. And of course, as you mentioned, there are 17 million kids ages 12 to 16, and that is important for herd immunity. If we want to reach herd immunity, it's important that every citizen, not just adult, get vaccinated so we can hit that number as quickly as possible.
Will this also prevent multisystem inflammatory syndrome?
I think that it should. Obviously, if the kids don't get COVID, they're not going to have the comorbidities that come along with COVID. Now, obviously, kids are not as likely to get infected with COVID, but there are quite a few scary anecdotal circumstances that when kids do get infected, they have very serious side effects. So that's another important reason to get vaccinated, because our kids are important. We don't know what the long-term impact of COVID is. So the sooner they get vaccinated, the safer they will be and the safer that we are all going to be.
What about kids under the age of 12?
That's a great question. Both Pfizer and Moderna are studying kids 6 and up, and even age 6 months and up. And I suspect that we'll probably have by mid-year, perhaps, or not mid-year, but by the end of the summer, good solid data, and for 6 and up. So we'll be able to vaccinate all school-age kids, which is really important. And I think that we're going to get there sooner rather than later. It's also important to note that even though Pfizer was the first to get the 12 and up designation, I think Moderna is probably swift on their heels. So we'll have a couple of choices there. So we'll have enough volume to get kids vaccinated.
What is the risk if kids don't get vaccinated?
Well, first, let me mention that kids are less likely to suffer from side effects of vaccines than adults. So that's important, I think, for parents to know. But if kids don't get vaccinated, they're at risk for getting infected, getting sick, suffering side effects, and also infecting others. So it really is a, brother's keeper type of situation where we have to look after ourselves, but we also have to look after everybody else. And that's as true for kids as it is for adults.
And what typically goes into a trial for kids? I know you and I have talked about this before on the show, but if someone's just joining us, how does that actually play out?
What you have for children, as you do for adults, is you have two groups of people, two cohorts, two arms, as we say in the business. One group gets the vaccine and one group does not. So that's called a placebo arm. And then you compare the results as to, in this case, COVID-19 infections of one against the other. And what the COVID-19 vaccine group for kids 12 to 16 got was 0 infections. Obviously, the placebo group did get infected, and that's why you have the 100% rate, which is really astounding.
And what about what's happening with the Johnson & Johnson vaccine and the now 28 cases of those rare blood clots out of the over 8 million doses that were administered?
I think the most important thing relative to the J&J vaccine is that there haven't been any incidences since the pause. This vaccine is back on the market. Doctors are now aware of side effects to look for, and that's important because when you know what to look for, you can catch it early and solve problems. It's really important to have more vaccines, especially a single-dose vaccine that can be stored at lower temperatures. So I think that people are understanding that the benefits of the J&J vaccine, and really of every vaccine, far outweigh the risks. And that's why I think we're seeing a bit of an uptick in vaccine volume. Hopefully that'll continue to build over the summer with kids coming online.
I know there's a bit of research being done on this right now, but what happens if you mix vaccine doses? For instance, if I were to get Pfizer and then Moderna, do we know anything about what happens when that happens?
The data on kind of mix and matching vaccines is very early and it's very anecdotal. Okay. It would be nice to know that you can mix and match. It would certainly help people go to different places to get their second shot. But I think the most important thing is to tell people that you need to get that second shot. A lot of people are kind of getting lazy. They haven't gotten their second injection as scheduled, and that's not good because both shots for the Pfizer and Moderna vaccines give you that 95% protection against COVID-19. One shot does not. And if people are concerned about side effects, they're transient. They pass. Having full immunity is so much more important. It's really terrific. And as we want to go back to work and socialize and be with our friends, it's as important for adults as it is for kids to have full immunity, not just for ourselves, but for everybody else.
And finally, Peter, is there anything else that you think our viewers should know about right now, whether it be about COVID and the vaccine front?
Well, I think, a lot of states are offering incentives. I think that's terrific. Check it out. If that's what moves you, so be it. There's no best reason to get vaccinated. There's only one reason to get vaccinated, and that's to do the right thing. I think the most important thing for parents to think about as their kids are able to get vaccinated is if you have any questions, talk to your pediatrician. They really are the experts in childhood vaccinations. They know the facts. You trust them. They want to help. Pick up the phone, go visit them, get the straight information, and make the smart decision.
A healthy dose of skepticism, as always. Former FDA Associate Commissioner Peter Pitts, thank you for your time.
My pleasure.